Welcome to Medical Therapeutic Yoga with Dr. Ginger Garner. The capsule test is a rather informal test. However, it can give us good information in a clinical screen. This test will subjectively inform the clinician about the quality of the hip capsule. A hip without capsule deficits and with capsular integrity can be expected to have a springy end feel. As you'll see, I'm demonstrating the surface area of the capsule and what it covers, what we'll be looking at. And we'll be externally rotating the hip to look at that end feel. As we look at the first hip, a hip that has suffered any damage, as I lift and lower the legs, just to put them in a comfortable resting position that's not compromised or contrived. When you look at a hip that has suffered any damage or acquired developmental impairments, it might have an empty end feel, which is unlike this one, which has a springy end feel. As we go to the other side, you notice a difference. You can work external rotation above the knee or below the knee, but if there's hypermobility in an ankle or a knee, you may choose to test by externally rotating the hip above the knee. I prefer to do both to make sure isolation of the capsule is being appreciated. As I'm testing the capsule, I'm also looking at hyperextension potential of each knee. As you'll notice, the capsule on one side is springy, and while the anterior capsule on the left side appears springy and even somewhat restricted, the posterior capsule shows no end feel, which also correlates with the knee hyperextension that was found on that side. If capsular deficits are noticed, hypermobility of surrounding joints, including the hip, should be evaluated more thoroughly. Thanks for joining me.